Hey everyone, and welcome to a deep dive into a topic that's super important for all you nursing students and faculty out there.
That's right. We're talking about newborns with special needs.
Exactly, and we're going to be breaking down all those key insights you need to know to provide awesome care for these tiny little humans.
I am excited to jump into this with you. We'll cover everything from birth weight variations to the NICU environment, and even touch on some of the sensitive topics, like how to support parents through those really tough moments.
Awesome, so let's dive right in. We all know that babies come in different shapes and sizes, but it turns out there's a whole science behind birth weight.
Right. It's not just about big or small.
Exactly. So how do we actually assess a newborn's growth and figure out if there might be any potential problems?
Well, we use these specific classifications like small for gestational age, or SGA, appropriate for gestational age, or AGA,
Yeah.
and large for gestational age, or LGO.
Okay, so those classifications are super important. But what makes each one unique? And what should nurses be looking out for in each category?
Great question. Each classification has its own set of things to consider. For instance, SGA babies can have trouble keeping their blood sugar stable, and they might even develop something called polycythemia.
Polycythemia. Now that's a mouthful. What does that actually mean for the baby?
So imagine trying to drink a milkshake through one of those tiny coffee stirrers.
Oh, wow.
That's kind of what it's like for these babies. Polycythemia means they have a really high concentration of red blood cells, which makes their blood thicker and harder to pump through their tiny blood vessels. It can lead to all sorts of problems.
Wow. So even the tiniest patients can have some really complex medical needs. And what about those LGA babies? I always thought they were just big and healthy. Is that not always the case?
Not necessarily. While some LGA babies are totally fine, they're actually more likely to have certain problems. Because of their size, they can be more prone to injuries during birth. Hypoglycemia can also be an issue, and they have a higher chance of developing jaundice because of something called hyperbilirubinemia, which means they have too much bilirubin in their blood.
So it's not as straightforward as it seems. No matter their size, these babies need careful monitoring and sometimes even special care. It sounds like nurses have to be extra observant to catch those subtle signs early on.
Exactly. Those observation skills are so important in making sure newborns get the best possible care. Early intervention can make all the difference.
Okay, let's shift gears a bit and talk about gestational age. We know that preemies, those born before 37 weeks, face their own set of challenges. But what about babies born after 42 weeks, those post-term babies? What makes them vulnerable?
Good point. Post-term babies can run into issues because the placenta, their lifeline in the womb, might not be working as well as it should. This can lead to things like meconium aspiration, which is when the baby inhales meconium. That's their first poop during labor or delivery.
That sounds pretty scary.
It can be. And then, of course, on the other end of the spectrum, we have those incredibly fragile preemies who face a whole other set of hurdles being born so early.
I can only imagine.
Premature babies have organ systems that haven't fully developed yet, so they're more susceptible to a whole range of complications. Respiratory distress is a major concern because their lungs aren't mature enough. They can also struggle to regulate their temperature, have trouble feeding, and are more prone to infections.
It makes you really appreciate all the advances in neonatal care that have helped these little fighters survive and thrive. And speaking of care, let's talk about the NICU environment. It's a place with high-tech equipment and 24/7 care. But I imagine it can be pretty overwhelming, especially for parents who weren't expecting their baby to need intensive care.
You're absolutely right. The NICU can be a sensory overload with all those beeping machines, bright lights, and constant activity. It's a lot to process on top of the stress of having a baby with special needs.
So how do we as nurses make sure we're providing that crucial life-saving care while also creating an environment that's supportive and developmentally appropriate?
That's where the concept of developmentally supportive care comes in. It's about understanding the unique needs of these babies, especially preterm infants, and finding ways to minimize stress and help them grow and develop properly.
That makes a lot of sense. So what are some specific examples of developmentally supportive care?
Well, think about simple things like grouping care activities together so the baby can get some uninterrupted rest.
Oh, that's a good idea.
We can also try to recreate the womb environment as much as possible using swaddling and positioning techniques. And of course, encouraging kangaroo care, where the baby has that skin-to-skin contact with the parent, is so beneficial.
I've heard amazing things about kangaroo care.
It really can make a difference. It helps regulate the baby's temperature, heart rate, and breathing. And it's fantastic for bonding and attachment, especially for babies who have to be separated from their parents because of their stay in the NICU.
It sounds like those seemingly small things can have a huge positive impact on these babies' lives.
They absolutely can. It's all about providing thoughtful and sensitive care.
Now let's talk about the parents. They must be going through so much emotionally when their baby is in the NICU, especially if their little one has special needs.
It's an incredibly tough time for them. Imagine the worry and uncertainty they're experiencing. It's a roller coaster of emotions.
What are some of the most common feelings parents might have in this situation?
It can be a whirlwind of fear, anxiety, guilt, even grief. They might wonder if they did something wrong or worry about their baby's future. It's our job as nurses to be there for them and offer compassionate support, not just for the baby, but for the whole family.
So how can we as nurses be that source of support during such a difficult time? What are some tangible things we can do?
Open and honest communication is so important. We need to explain everything that's happening clearly and make sure the parents understand. Encouraging them to participate in their baby's care, even if it's just holding, touching, or talking to them, can be really powerful. It helps them feel connected and empowered.
Building trust and rapport must be essential.
It is. We need to validate their feelings, recognize their expertise as parents, and help them tap into their own strengths and coping mechanisms. Remember, we're all in this together, working as a team to provide the best possible care for their baby.
Now, before we wrap up this part of our deep dive, I want to touch on a specific group of newborns who sometimes get overlooked: late preterm infants. They're born between 34 and 36 weeks, so they seem pretty close to full term.
Right.
But I'm guessing they still face their own unique challenges.
You bet. They can easily slip under the radar because they look so close to being full term, but they're still at risk for complications like respiratory distress problems, regulating their temperature, and difficulty feeding.
So even though they might not need the same level of intensive care as very premature infants, we still need to be aware of their specific needs.
Exactly. We need to make sure parents understand the potential challenges and that they have the support they need once they take their baby home. It's important to remember that every newborn, no matter their gestational age, needs individualized care that's tailored to their specific needs.
This has been so insightful already. I can't wait to keep exploring this topic.
Me too. There's still so much more to learn.
So stay tuned, everyone. We'll be right back with more on newborns with special needs after a quick break.
Yeah, we've only just scratched the surface. It's such a complex and ever-changing field as we learn more about what these little ones need.
I'm ready to dig deeper. We were just talking about late preterm infants and how even babies born close to full term can face some challenges. It's a good reminder that we can't get complacent in neonatal care. Every baby deserves that personalized approach.
Absolutely. And that brings us to a topic that's tough to talk about, but so important: the reality of perinatal loss. As much as we try to give the best care sometimes, despite our best efforts, a newborn doesn't make it.
That's heartbreaking. And I imagine it must be incredibly difficult for nurses to deal with. It's not just about caring for the baby, but also supporting the family through such unimaginable grief.
You're right. As nurses, we need to be ready to offer sensitive and compassionate care to those families who are experiencing this kind of loss. It's one of the hardest parts of our job, but it also speaks to the deep human connection that's at the heart of nursing.
I can't even imagine what those families must be going through. What are some ways we can help them navigate such a devastating experience? Where do we even begin?
Sometimes the most powerful thing we can do is just be there. Be present. Listen without judgment. Validate their feelings. Offer a shoulder to cry on. Remember that everyone grieves differently, and we need to respect their individual needs and coping mechanisms.
But it's not about trying to fix things or offer empty platitudes, but really just being there with them in their pain.
Exactly. And there are some practical things we can do to help families honor their baby's memory. Encourage them to hold their baby, take pictures, create keepsakes. Those tangible reminders can be so meaningful.
It sounds like allowing them to express their grief in their own way and at their own pace is so important.
Absolutely. We need to be mindful of their cultural and spiritual beliefs, too, and how those might influence their grieving process. Some families find comfort in religious rituals, while others might prefer more secular ways of honoring their baby's memory. Our role is to support them in whatever way feels right for them.
That really highlights the importance of individualized care, not just for the baby, but for the whole family. It's a holistic approach that recognizes the huge emotional impact of this experience.
It is. It reminds us that nursing goes beyond just medical tasks. It's about human connection, empathy, and being there for families during the darkest moments of their lives.
We talked earlier about the NICU environment and the idea of developmentally supportive care. It sounds like a lot of thought goes into creating an environment that truly supports the well-being of these fragile infants.
There really has been a shift in thinking, moving away from that traditional, sometimes chaotic NICU setting to one that's much more calming and nurturing. We're realizing how much the environment can impact these tiny patients.
I'd love to hear more about what that looks like in practice. What are some specific strategies that are being used to create a more developmentally supportive NICU?
One key strategy is dimming the lights at night to help regulate the baby's sleep-wake cycle. We also try to minimize unnecessary noise and stimulation, recognizing that even things like a slamming door or a loud conversation can disrupt these infants' delicate systems.
It makes you realize just how sensitive these babies are to their surroundings.
They really are. And we're learning more and more about how important it is to mimic the womb environment as much as possible. This includes swaddling to provide a sense of security and containment, and promoting skin-to-skin contact or kangaroo care whenever we can.
I've heard so much about the benefits of kangaroo care. What makes it so powerful, especially for babies in the NICU?
It's pretty amazing, actually. Kangaroo care helps regulate the baby's temperature, heart rate, and breathing. Plus, it promotes that crucial bonding and attachment between parent and baby, which is especially important when they've been separated because of the NICU stay.
It sounds like a win-win for both the baby and the parents, supporting both their physical and emotional well-being.
Exactly. It's a great example of how we're moving towards a more holistic and family-centered approach to care in the NICU.
Now let's talk about pain management. These babies, especially those born prematurely, go through so many procedures and interventions. It must be crucial to recognize and address their pain.
Absolutely. Pain management is a critical part of neonatal care, and thankfully we've made great strides in recognizing and addressing the pain these infants experience. It's hard to believe that people used to think babies couldn't feel pain.
I know. It's almost unthinkable now. Thankfully, our understanding of neonatal pain has come a long way.
It really has. We now know that infants, even those born very prematurely, do experience pain, and it's our responsibility to manage it effectively. We have a range of both pharmacological and non-pharmacological approaches we can use.
What are some examples of non-pharmacological pain management techniques that are commonly used in the NICU?
Non-pharmacological methods are often our first line of defense, especially for mild to moderate pain. These might include things like swaddling, skin-to-skin contact, non-nutritive sucking, like offering a pacifier, or even something as simple as giving a little bit of sucrose solution.
Sucrose solution, really? Does that actually work for pain management?
It does. It's amazing how effective a little sugar water can be in calming a baby and reducing their perception of pain. It's a sweet and simple intervention that can make a big difference.
I never would have guessed. So when are pharmacological interventions typically needed for these little ones?
We usually reserve those like opioids or acetaminophen for cases of more severe pain or when non-pharmacological methods aren't doing enough. It's all about finding that right balance and tailoring the approach to each baby's individual needs.
It sounds like pain management isn't a one-size-fits-all approach. We need to carefully assess each baby, consider their gestational age and overall health, and choose the interventions that will best minimize their suffering.
Exactly. It's about providing compassionate care and advocating for these vulnerable infants who can't always tell us what they're feeling.
Let's switch gears a bit and talk about feeding challenges. We know that preemies often struggle with coordinating, sucking, swallowing, and breathing, which can make feeding a real obstacle.
It's a common problem for preemies, and it can be really frustrating for both the baby and the parents. Their immature digestive systems and lack of coordination can make feeding a real uphill battle. And of course, getting enough nutrition is absolutely essential for their growth and development.
So how do we make sure these babies are getting the nourishment they need to thrive? What strategies are used in the NICU?
The approach really depends on the baby's gestational age and overall health. For very premature infants, intravenous nutrition might be necessary at first. But as they grow and mature, we gradually transition them to enteral feedings, which can be given through a feeding tube, or ideally by breastfeeding or bottle feeding.
I can imagine that supporting breastfeeding mothers is especially important in this context. Breast milk is often called liquid gold, especially for preemies.
It really is. Breast milk has all the nutrients babies need in an easily digestible form, and it's packed with antibodies that protect them from infection. It's especially beneficial for preterm infants who are more vulnerable to getting sick.
So how can nurses best support breastfeeding mothers whose babies are in the NICU?
Encouraging them to pump their milk regularly is key, and providing education and support on things like latch and positioning can make a big difference. We also need to be sensitive to the emotional challenges they might be facing and offer a listening ear and words of encouragement. Breastfeeding can be tough even under the best of circumstances, and having a baby in the NICU adds another layer of complexity.
It sounds like it takes a real team effort. The medical team, the mother, and of course the baby all working together.
Absolutely. We all have a role to play in ensuring that these infants get the best possible start in life, and that includes supporting mothers in their breastfeeding journey.
We've talked about respiratory distress as a common complication for preemies, but I know there are a lot of other potential problems they can face. Can you tell us about some of those other complications that nurses should be aware of?
Absolutely. Prematurity comes with a whole host of challenges. One we haven't touched on yet is necrotizing enterocolitis, or NEC for short. It's a serious condition that affects the intestines and can be life-threatening.
That sounds really scary.
Well,
What causes NEC, and are there any preventative measures that can be taken?
the exact cause of NEC is still a bit of a mystery, but we think it's related to a combination of factors, including immature intestines, formula feeding, and infection. Breastfeeding is considered the best way to prevent it because breast milk has protective factors that promote gut health. We also try to introduce feeding slowly and carefully, watching babies closely for any signs of intolerance.
So minimizing those risk factors and being really vigilant and monitoring for any early signs of trouble is key. What other complications should nurses be watching out for in preemies?
Another one to be aware of is intraventricular hemorrhage, or IVH. It's bleeding into the ventricles, which are the fluid-filled spaces in the brain. It can happen in any newborn, but it's much more common in premature infants.
What are the implications of IVH? What kind of impact can it have on the baby's health and development?
The severity of IVH can vary a lot, and the impact really depends on how much bleeding there is. It can potentially lead to a range of problems, including developmental delays, cerebral palsy, and even death in severe cases.
So early detection is crucial. What are some of the early warning signs that nurses should be watching for?
The signs can be subtle. So close observation is really important. We look for things like lethargy changes in muscle tone seizures, difficulty feeding. Early detection is key because sometimes prompt intervention can help minimize the damage caused by the bleeding.
This really underscores the importance of vigilance and attention to detail in neonatal nursing. It's not just about recognizing the physical signs of complications, but also understanding these infants' unique developmental needs and creating an environment that supports their overall well-being.
You've got it. It's about seeing the whole picture, the baby's physical health, their emotional well-being, and their developmental progress.
We've talked about minimizing stress and creating that sense of calm and security in the NICU. What are some other key principles of developmentally supportive care that nurses should be aware of?
One important aspect is promoting self-regulation. Premature babies often have trouble regulating their own states of arousal. They might get overstimulated easily or have a hard time transitioning between sleep and wakefulness.
That makes sense. They haven't had as much time to practice those self-soothing skills in the womb like full-term babies have. So what can we do to help them develop those self-regulation skills?
Things like swaddling, gentle rocking, and minimizing environmental stimulation can all help. We also try to cluster care activities so they have periods of uninterrupted rest.
It all goes back to creating that nurturing and predictable environment that helps them feel safe and secure.
Exactly. Remember, these babies have been thrust into a world they weren't quite ready for. It can be really overwhelming for them. Our job is to make that transition as gentle and supportive as possible.
And a big part of that is supporting the parents, too, right? They're the ones who will be caring for these infants long after they leave the NICU.
You're absolutely right. Parental education and support are crucial components of neonatal care, especially when it comes to infants with special needs. We need to give parents the knowledge and confidence they need to handle the challenges ahead.
What are some of the key areas where parents need guidance and support? What are the essential things we need to teach them before they take their baby home?
We need to educate them about their baby's specific needs, whether it's feeding difficulties, temperature regulation, or managing a particular medical condition. We also need to teach them how to spot signs of potential problems and what to do if those come up.
It's about empowering them to be their child's best advocate.
Exactly. We want them to feel confident in their ability to care for their child and to know that they have a team of healthcare professionals to support them along the way. And it's not just about practical skills, it's also about emotional support. These parents are going through a lot, so we need to offer a listening ear, validate their feelings, and help them connect with resources in the community.
It's a reminder that nursing is a holistic profession. We care for the whole person, not just their physical ailments.
Absolutely. And when it comes to newborns with special needs, that holistic approach is more important than ever. We need to address their physical needs, their emotional well-being, and their developmental progress.
Now let's focus on the transition from the NICU to home. I imagine that's a huge step for both the baby and the family.
It is. Discharge planning is such a crucial part of neonatal care, and it requires careful coordination among the medical team, the family, and any community resources that might be involved. It's all about setting the baby and family up for success.
What are the most important parts of a successful discharge plan? What are the key things to consider?
First and foremost, the baby needs to be medically stable and ready to handle life outside the NICU. They need to be able to maintain their temperature feed effectively and breathe on their own. We also need to make sure they're gaining weight like they should, and that any underlying medical conditions are being managed well.
It sounds like there are a lot of things to check off before baby can go home. It's not a decision that's made lightly.
You're right. And it's not just about the baby's physical health. We also need to assess the family's readiness and give them the education and support they need to feel good about caring for their child at home.
What are some specific areas where parents might need extra education and support before they take their baby home from the NICU?
We need to make sure they understand their baby's specific needs, how to give any medications, and how to use any special equipment they might need, like a feeding tube or oxygen. We also want to be sure they know how to recognize signs of potential problems and who to call if they have any concerns.
It's all about empowering them to be their child's best advocate, to know what to watch for, and to feel comfortable reaching out for help when they need it.
Exactly. And it's important to remember that discharge isn't the end of our involvement. We want to make sure these families have access to ongoing support and resources in the community. Things like early intervention programs, support groups, or home health services.
It's a continuum of care that goes beyond the hospital walls.
Exactly. We want to make sure these babies and families have the support they need to thrive both in the hospital and at home.
This deep dive has been so insightful. It's clear that caring for newborns with special needs requires a unique combination of knowledge, skill, and compassion.
It does. But it's also incredibly rewarding to see these little fighters grow and thrive and to witness the strength and resilience of families. That's what makes this work so meaningful.
It's a privilege to be a part of these babies' journeys, and I think you've done a great job of highlighting the nuances of neonatal care and the incredible impact that nurses can have.
Thank you. It's been my pleasure. Working with these little ones is truly a privilege, and I'm grateful for it every day.
And to our listeners, we hope this deep dive has given you valuable insights into the world of neonatal care and the incredible resilience of these babies and their families. We've covered so much ground already, from the tiniest details of caring for preemies to the bigger picture of supporting families through those tough times. It's amazing how much neonatal nursing covers.
It really does. It's a field that requires a deep understanding of complex medical stuff, but also a huge heart for these tiny babies and their families.
You mentioned before that discharge planning is super important in neonatal care. And it's not just about making sure the baby's medically stable, right? It's about making sure those parents are ready and feel confident to take their little one home. What are some things parents need help with during this transition?
We want parents to feel like they have all the tools they need to care for their baby at home. That means giving them clear information about their baby's specific needs, like dealing with feeding problems, keeping them warm, or managing any health conditions. And it's also really important to teach them how to spot signs of trouble and who to call if they're worried.
It's all about giving them the knowledge and the confidence to be their baby's best advocate.
Exactly. We want them to feel comfortable asking for help when they need it, knowing that there's a whole team of medical professionals there to support them every step of the way. And it's not just about practical stuff either. We also need to think about the emotional side of things. These parents have been through a lot, so just listening to them, validating their feelings, and connecting them with support groups and resources in the community can make a huge difference.
It's that holistic approach, again, realizing that how a baby's doing is connected to how their family's doing.
Exactly. We want to support the whole family, making sure both the baby and the parents have what they need to thrive.
Now, I want to go back to something we talked about earlier, the emotional roller coaster of having a baby with special needs.
Yeah.
That's got to be a lot for any parent to handle.
It really is. Imagine having all these hopes and dreams for your child, and then suddenly you're dealing with all these new challenges and uncertainties. It's totally normal to feel a mix of emotions: shock, disbelief, guilt, anger, sadness.
So it's really important for nurses to understand those reactions and to be supportive without judgment. What are some practical ways we can do that?
Sometimes the best thing we can do is just be there. Be present. Listen without judging. Validate their feelings. Give them a shoulder to cry on. Let them know that whatever they're feeling is okay. And don't forget about dads, too. They might show their emotions differently, but they're going through the same adjustment.
It's about recognizing that there's no one right way to cope with this. Everyone handles it differently.
Exactly. And it's super important to connect parents with resources and support systems. Support groups can be a lifesaver, giving them a chance to connect with other families going through the same things. There are also organizations that offer information and resources specifically for families of kids with special needs.
I bet those connections can really help with those feelings of isolation and being overwhelmed.
They definitely can. And never underestimate the power of just offering words of encouragement. Let those parents know they're doing a great job and that you're there for them every step of the way.
This deep dive has really shown me just how complex and rewarding neonatal care is. We've talked about so much, from the nitty-gritty of caring for preemies and babies with different birth weights to the importance of creating that supportive environment and managing pain. And we also touched on the emotional side of things, like helping families deal with the loss of a baby and supporting parents who have a baby with special needs.
It's been quite a journey, and I think you've done an amazing job summarizing the key points for our listeners. Neonatal nursing is tough, but it's also incredibly fulfilling. To see these tiny babies grow and thrive, and to see how strong and resilient their families are, that's what makes this work so special.
It's an honor to be a part of these babies' lives, and I think you've perfectly captured the heart of neonatal care and the incredible impact nurses can have.
Thanks. It's been a pleasure. Talking about these little ones is something I'm truly passionate about.
And to all of you listening, we hope this deep dive has given you valuable insights into the world of neonatal care and shown you just how strong these babies and their families are. Remember, you're not alone in this. There's a whole community of nurses, educators, and resources out there to support you. So never be afraid to ask questions, to seek guidance, and to keep learning. The world of neonatal care is constantly changing, and with your dedication and compassion, you can make a real difference in the lives of these amazing babies and their families.